This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
And good morning. Welcome into the program, Mon Health Talk. Dave Wilson and Sarah Josie with you. Good morning, Sarah.
Good morning, Dave.
And our guest this morning, Dr. Melinda Cooper, Mon Health Wedgwood Primary Care and Psychiatric, Pediatrics, and Internal Medicine Diabetes Specialist. Dr. Cooper, good morning.
Good morning.
Do you squeeze all that on your business card, by the way?
No, I don't.
Also joining us, Andrea McCarty, Mon Health Medical Center Diabetes Education Coordinator. Good morning, Andrea.
Good morning. Thanks for having us.
Well, guys, thanks for taking a few minutes with us here on Monday morning. And Sarah, as you might have guessed by those two titles, we're going to be talking about diabetes and, in particular, preventing diabetes this morning with our guest. But first, let's give them a chance to talk about themselves. Because, who doesn't want to talk about themselves? Right? Our whole show is based on that, Sarah. Dr. Cooper, start with you. Just tell us a little bit about yourself, your education, how you ended up with the Mon Health family.
Sure. I grew up in West Virginia in the Eastern Panhandle and came out to WVU for undergrad and studied here for medical school and residency, and I've been here ever since.
Yeah, we hear so many of those stories, don't we? Came to WVU and they never left, and that's a good thing, Dr. Cooper.
Well, thank you. I've enjoyed it. I've been with Mon now since this summer, so it's been a wonderful experience.
And Andrea, what's your story?
Well, I came here reluctantly as a teenager, kicking and screaming, and I've not really left since. WVU grad and also spent some time at Marshall as well. And I was in my career for about 10 years before landing at Mon Health 13 years ago.
And you've never left since, have you? Same story, still here.
Yes.
We hear so many times, folks, that there's not a lot of turnover. People get in the family, and Andrew, they stick around. There must be something going on right at Mon Health for that to be the scenario.
Mm-hmm. There is. I agree. It's a good fit.
Well, November is Diabetes Awareness. Hard to believe we're into November, by the way, but it's Diabetes Awareness Month. And Dr. Cooper, we'll pitch you this question here. Generally speaking, what is diabetes? We hear about it an awful lot. We see commercials for it all the time. We hear about medications for it, so on and so forth. But what is it?
Well, in general, diabetes is when our body doesn't process sugars that we eat well. Type 1 diabetes we typically think of as being in children, but we can see it at all ages. That occurs when the body stops making enough insulin. The immune system kind of attacks itself and can't make enough insulin. Type 2 is what we see more commonly in most adults, largely because of family history and because of obesity, and that's when our body just doesn't respond to insulin that we're producing.
When we're looking at something like diabetes in the state of West Virginia, this is a really important conversation to be having because last I read, 1 in 8 adults have diabetes in our state. 1 in 4 don't even know they have it. So, first of all, why do you think it's so prevalent here when comparing this to national statistics, or is it not? Is this about the national average? And then let's talk a little bit about how would you even know you have it if 1 in 4 don't?
Well, so West Virginia in particular has one of the highest rates of obesity, and that's one of the leading risk factors for type 2 diabetes. So that's why we see it so often. A large number of people don't know because early on the symptoms are not anything that most people would recognize if they have any at all. But by having a primary care doctor, seeing their doctor regularly for screening tests, we can detect it early and do more to prevent long-term complications from it.
And once someone has someone in their family that has had it, so for example, if I have a grandparent that has it, how does that impact me in the types of screenings or the type of conversations I should be having with my physician?
Well, sure, yeah. Having a family member that has had diabetes certainly increases your risk. So whenever I have patients that have had that family history, certainly we talk more about trying to maintain a healthy weight, eating the right types of diet, and screening with blood work such as a fasting glucose periodically, at least once every year or two, to try to detect that.
Our guest this morning, Dr. Melinda Cooper, Mon Health, Wedgwood, Primary Care. I'm not going to read the whole list. She does a lot of things. She's very talented. Andrea McCarty, Mon Health Medical Center, Diabetes Education Coordinator. We are talking diabetes prevention this morning.
We are. Okay, so let's pick up where we had just left off. We were talking a little bit about, the fact that we have some pretty high statistics here in the state. 1 in 4 people don't even know they have it. So we were talking about how important that relationship with your physician is. So let's talk a little bit, too, about what happens if you do have diabetes. What does care look like? What is it like to manage it? And am I at higher risk for other medical problems?
Sure. Yeah. If I have somebody that we're doing screening tests and we detect that they have prediabetes or diabetes, then the biggest thing we focus on initially is getting them some diabetic education, learning about making better choices with their foods, trying to make sure that they're at a healthy weight, trying to make some lifestyle changes because, yes, absolutely, diabetes definitely increases the risk for a number of things. Heart disease is a big one, but also there's a number of other complications that can be associated with poorly controlled diabetes if you have it long enough as well.
Once I have diabetes, can I ever be cured? Do I ever not have it?
Well, if somebody is, if we're catching that in the early stage in the disease, then yes, if they are able to lose weight, be able to improve their diet, they may never need to, be on medications. It is something that we still need to monitor for periodically, but it may be something that we can get some of the labs that we follow in terms of how well that controlled that is, get it down to the normal range.
You mentioned earlier as we were talking about the different types, and I think people get confused about that a little bit, but you mentioned type 1 and type 2 and how type 1 we often associate with something that somebody's maybe born with or children. What is the difference in regards to diabetes between children and adults?
So with type 1, there's not typically any relationship between weight. It's something that, it starts pretty quickly and progresses rapidly because their body is quickly having a loss of the cells that produce insulin. And so we see a very abrupt change in their symptoms that we see in children, although up to 25% of people may not develop type 1 diabetes until later in adulthood. So we think of it as being in children, but not necessarily. Type 2, because it is strongly related to genetics and obesity, and because we're seeing the rates of childhood obesity increasing, we're actually starting to see that more in children even as well. So the lines are blurring a little bit, but there's different causes behind the two.
And so as we're talking about that, and there being different causes, I have 2 children. Are they at risk for getting diabetes, or what does that look like?
Well, so if we're talking about type 1 diabetes, it's something that we don't know necessarily. It's an autoimmune cause. So there's not typically any kind of genetic predisposition for it. There's not something that we can watch for. Now, if there's that family history of type 2 diabetes, then yes, as they get into adulthood, that's certainly watching and making sure they're healthy, staying at a healthy weight is really important.
But can children get type 2 if we're dealing with? Okay.
They can, yes. Yeah, like I said, mostly because of obesity that we're seeing in children.
Right.
Andrea is the Mon Health Medical Center Diabetes Education Coordinator, which would imply, Andrea, that Mon Health has programs for diabetes education and prevention. So what do those programs entail?
Well, we do have 2 different programs. The one for prevention is the National Diabetes Prevention Program. We started in 2013, And each one of those programs, that one is a series of 24 sessions over the course of a year with a focus on promoting weight loss, increasing physical activity as a means to prevent or delay the diagnosis of type 2 diabetes. It's ideal for those people that have prediabetes, which really goes into that category of the 1 in 4 people that have diabetes and don't know they have it. And our other program is the Diabetes Self-Management Education Program, where we're going to go over blood glucose monitoring and physical activity, meal planning, medications, stress management, and in most cases, for those individuals with type 2, also get some direction for weight loss if it's indicated.
Now, the programs are nationally recognized. How do you earn this honor, and what exactly does that mean to the patient or the person who might be interested?
Well, the ADA recognition is for our diabetes education program, and we have to apply for that every 4 years, have to maintain certain information and get certain information on all of our patients. Then we apply to maintain that recognition. If we do, that means insurance covers the service for the patient. For the diabetes prevention program, we are recognized by the CDC, and that was also the first step to get insurance to cover that program.
And so having this for the patients here in our local listening area, this is a really big deal. And it's one of those resources that, you know, I don't think we brag enough about ourselves and these types of things that we have going on. So I guess I just wanted to, it's not really a question, it's more of a comment. I wanted to reiterate, hey guys, this is really great. And this is really wonderful that we have access. So if someone's listening and they need access to programs like this, how do they get registered? Do they need a referral? What does that process look like?
Well, for the diabetes education program, they do need a referral, but they can still just call our office and express interest. We can get some information from them, and we can reach out to the provider and request the referral for service. For the diabetes prevention program, we don't need a referral for that. It's more a self-referral, and they can reach us either at monhealth.com or they can call the office at 304-598-1805.
Andrea, how important is it to reach people when they are younger? You know, as they're coming up through elementary and middle schools to learn about nutrition, learn about healthy diets, so later in life you don't develop some of the problems and have to deal with some of the issues we've talked about this morning?
I think when you look at the information that we have available to us, our eating habits are pretty much established by the time we're 5 years old. So the further away we get from the age of 5, the more rooted in those routines we become. So the earlier we can make changes, introduce healthy foods that actually will taste good to someone, they're more likely to stick with that. But it's important not only for the children to be aware, but for the family to adopt that. Because if the children are the only ones that are wanting to eat healthy, but they're not the ones buying the groceries, it's not going to work very well.
So, again, this is maybe more of a philosophical question, but since you do this every day, how do we do that? How do we break that cycle?
It starts with what, you know, when you look at adults, we eat what we know. And we eat what we know because it's what we grew up with. It's what we were exposed to. We usually are hesitant to try something new that looks different or we're not sure how it will taste. So it's really important at a young age to introduce all kinds of foods to kids. And keep in mind that they estimate that a food has to be offered to a child 9 times before they definitively can decide, yep, I just don't like that. But if they're young, they should be asked to try these foods again because our tastes do change. But you have to be persistent in introducing healthy food options.
Hey, it only took me 36 years to try Brussels sprouts.
Do you like them?
Yeah, now I do.
See?
But it only took 36 years.
But hey, it's 36 years lost without Brussels sprouts, but you can make up for it now.
Didn't know what I was missing all that time. Yeah. Give out the contact info. Dr. Cooper, if folks need to get in touch with you, where can they reach you at?
Sure. I'm located at the Wedgwood office in the Medical Park Plaza near the hospital. They can go to monhealth.com/primary care and can schedule an appointment that way. Or if they wanted to try to schedule with me particularly, they can call the office at 304-599-9400.
And Andrea, what about you?
If they're interested in learning more about our programs, they can call our office at 304-598-1805, and there's also more information on us on monhealth.com.
And we mentioned this, I think, every single show, Sarah, and it applies to so many different avenues when we're talking about our general health and well-being. Diet, exercise, don't smoke. Boy, you can prevent a whole heck of a lot of things. Dr. Cooper, you can weigh in here quickly if you like. You can prevent a whole lot of things if you focus on those three things.
Absolutely can, yes. Tons of things. So, very important.
Including diabetes. I'm not wrong there. Correct me if I'm wrong, guys.
No.
Okay.
Absolutely.
I mean, I play a doctor on radio once a week on Mondays. So. Well, guys, thank you very much for your time this morning. Great information, and be safe. Have a great week.
Thanks.
You too.
Dr. Melinda Cooper, Mon Health Wedgwood, Primary Care and Psychiatry, Pediatrics, and Internal Medicine Diabetes Specialist, and Andrea McCarty, Mon Health Medical Center Diabetes Education Coordinator. We do podcast these shows for you online. You can get them over at the website, and always go to the Mon Health Facebook page as well for more information about Mon Health in general over there.